So this year's been a really exciting year for the CEPN. We've built on the strengths of the previous year and gone forward learning together more effectively and delivering care more effectively as integrated care teams. We've managed to attract over 100 organisations and representatives from those organisations to learning events throughout the year, which is a real testament actually to the collaborative nature of the education programme that we've set up. That's great, but we have more work to do. There's new colleagues who are joining us in community care. We're delighted in the GP care group to welcome the health visiting teams to the GP care group and hope that their presence, together with the Family Nurse Partnership, will enable us to really consolidate the children's offer for community services. We're working very closely amongst THCEPN partners to sustain the Vanguard in year 2 for that, and also we should be hearing this week or next week the outcome of the Community Health Services contract, which we're very hopeful that we'll secure and be able to work collaboratively together to deliver true integrated care for our patients and the community as a whole.
So this is a brand new programme, very exciting. We're trying to think of something that will really help bring staff together to support the integrated care programme in Tower Hamlets, which is a big topic that we're all working together on. And what we decided to look at was possibly doing a master's level programme, which we decided we'd like to design from scratch because nothing was available from any of the health education providers. So we decided to design something new, which was a master's level programme, a course, a module with 40 credits at master's level, and it's called the Theory and Practice of Integrated Care. So it's quite a challenge to set the programme up because it was new and nobody had ever done it before. So our recruitment was quite difficult. We found that quite difficult. We originally started with a recruitment into a very small area, locality, which would have been about 8 general practices within Tower Hamlets. But in fact, in the end, we decided to advertise it wider because we didn't get enough responses. But what we did get when we advertised it wider was a wonderful mixture of people from different settings, and it included primary care staff. We had 2 GPs come along, community health nurse team leader. We had an occupational therapist, a physiotherapist, 2 care coordinators, mental health nurses, I think I've said that already, and a nurse from a palliative care unit as well, St Joseph's. Well, it was very exciting to design it with London South Bank University, who developed it. So the module is called the Theory and Practice of Integrated Care. We designed it with theory in the morning and practical in the afternoon, and that worked very, very well. And the afternoon was action learning groups, which brought the people from different organisations, different disciplines together, and that worked very, very well. It's been very successful. We've had a lot of feedback about the fact that people understood integrated care much better. They thought about the barriers. The coursework was very practical. The coursework was to work together in groups and to create new systems and ways of working that would improve care for patients. So it's very patient-centred. People really enjoyed it. People enjoyed working with other professionals. A lot of people felt that they hadn't understood each other's roles very well at all until that point. So, and also they all reported back on the evaluation we've done so far that their patient care has improved, and that's a really good thing.
We've been working together really with our partners on the integrated care programme. So this has been about developing the workforce to actually be skilled up and deliver integrated care. And we started this with developing mental health competencies and non-mental health staff. And alongside that, we actually developed competencies mental health staff working in primary care and liaison work within the community health teams. With the competencies haven't been fully rolled out yet, and we wanted to develop them further, looking at a core set of competencies for all staff working in integrated care. So what we're doing is working with a university to develop those, because there aren't any out there at the moment. There are competencies around behaviours and attitudes, but we actually also wanted to touch on actual skills needed to deliver integrated care. So that was money that we had used from last year's funding, but we will be carrying on this work. It will take around 9 months, and working jointly with all the partners, and then we'll look to actually roll that out. That was part of the first lot of competency work that we did. The idea was to do a training needs analysis from that. What we were able to do was find some training needs for non-mental health staff, so that a lot of that was in crisis resolution, managing risk, understanding mental health, understanding dementia. Now, some of that training was delivered by the mental health liaison nurses, but the other was delivered by the vocational programme at London and South Bank University. In the same way, the mental health nurses, through using their competencies, we were able to establish some of their training needs, which there was a lot around identifying a deteriorating patient. We work with South Bank University on the documentation as well, and governance issues for unregistered staff was also something that was identified as being quite high in terms of a training need. And then of course we look for feedback. So the post-training feedback, emails were sent out, and 100% of people said that they had changed their practice from attending the vocational training programmes.
Making every contact count is a behaviour change model. It basically helps individuals who are having contact with the public on a daily basis to actually promote and engage them in healthy lifestyles, like physical activity, mental health, and their well-being as well. So it's about having conversations, when you meet someone, having a conversation around any of those areas. In the beginning, Making Every Contact Count was part of a two-part training program. It was participatory appraisal as a first session, and then you went on to do Making Every Contact Count, and that was with GP practices. However, we found that didn't work because a lot of staff could not be released to attend. Therefore, that was like a barrier, and the uptake was really poor. We then decided to use the general practice protected learning times to invite healthcare assistants and other health professionals and frontline staff to attend these sessions, which worked out well because we had a better uptake and from multidisciplinary teams as well, and they were quite engaged in Making Every Contact Counts. Overall, the Making Every Contact Counts training has attracted 75 participants. One of the participants said that as a direct result of this training, their active listening skills have actually improved.
This is a program that's been running for the last 8 years, and we do an intake about once a year, and it's for all HCAs who are working in Tower Hamlets. We usually take on about between 8 and 12 to each cohort. It runs in conjunction with the Open University course. We do 6 clinical skills days and 6 days of Open University modules. Now that means that it can run over 3 months, every 2 weeks, there's a day every 2 weeks. It's been very successful in the sense that we've trained a very significant majority of healthcare assistants working in GP practices. We have designed the course specifically to meet the needs of what is required of a healthcare assistant who works in general practice. We didn't have huge issues and challenges. It may have been where perhaps we had to rush our recruitment, in the sense that we might have had just 3 months to recruit, and perhaps if we had a bit more time we might have got more people on the course. That was the main challenge.
We're hopeful that that will develop greater and better outcomes in learning as well. Specifically, for example, in terms of safeguarding, it's a much richer experience to learn together and discuss safeguarding issues. And across the partners, this will really be the seed, the CEPN will be the seed of more effective learning in years to come. The CEPN won't be with us forever, but what it has allowed us to do is to put structures in place that will deliver in years to come. It was allowed us to make sure that there is an ethos of learning across the patch and across the community care service.